Everyone, we'll get started and ask Lorian to get us moving.
Okay. Well, good afternoon. This is our last day of hearings. In this final session, we'll hear about the Department of Public Services, including Culture and Recreation and Human Services. We'll be starting with Culture and Recreation, which is on page 450 of your binders, behind the Culture and Recreation tab. And with that, I'll turn it over to Tim Kaufman.
Good afternoon, Commissioners. They did save the best for last, so
Yeah.
I'm glad that I'm in this slot. We have been, first of all, I'd like to introduce some guests. We've got John Mosley, who's the president of the Expiration Place Board with us today, with Jan Luth, and then I've got staff Marilyn Cook, Dee Neiswanger, Adrian Byrne, and Mark Schroof. Annette Graham is in Topeka working on state issues today, and Jeff is back at his office trying to figure out what's going on. So I'm going to cover everything for folks, and I've got lots of help in the room if we've got questions about things. We were asked to submit flat budgets. We did that. That's going to be the theme that you're going to hear. I've got a lot of slides because we wanted to make sure that we provided you all the information that there is about our programs, but I'm not going to touch on every one of them because we did a flat budget for you. But starting with the Culture and Rec, I'm going to talk about four different programs. There's a community programs budget, there's the Expiration Place budget, there's the zoo budget, and then we've got some parks budgets in Culture and Recreation. And Culture and Recreation is part of our Human Services and Cultural Experience section of the strategic plan, and we partner with lots of different entities to deliver culture and recreational services. We partner with a number of different nonprofit organizations and have a lot of nice public-private partnerships to deliver those services in the community. The Community Programs Fund, that budget identifies 4 different partners that we fund: the Sedgwick County Fair, the Kansas African American Museum, the Wichita Sedgwick County Historical Museum, and the River Festival. And these attractions are available to all citizens and guests in the community. And I'd like to point out that they're all managed by nonprofit boards who volunteer their time to help make sure that these services are available in the community. And these are property tax funded programs. The fair has about 25,000 to 30,000 visitors each year. Fair's coming up in about 6 weeks now. The Kansas African American Museum is the premier location for learning about Kansas's African American history. It's located in the former Calvary Baptist Church here within the courthouse complex. They had almost 6,000 visitors in 2016. The Wichita Sedgwick County Historical Museum is located in the original City Hall. They use both traveling and permanent exhibits, and they are a hot spot for school field trips, and they served over 16,000 people in 2016. And the Wichita River Festival is a 10-day event that starts next week, and it's attended by over 370,000 patrons each year, and we've got some funding in the budget for them in 2018 as well. The general fund request for 2018 is $302,472. That's down $5,000. We're going to fund the River Festival at $15,000 this year, and we're going to go back down to $10,000. We've budgeted to go back to $10,000 for 2018. Everything else is going to be flat. Any questions about the community programs? That's all contractual. There's no staff involved in those community programs. If not, I'm going to move on to Expiration Place. That's on page 472 in your binder. And their mission is to inspire deeper interest in science through creative and fun experiences for people of all ages. And the strategic result that we have in our strategic plan for Expiration Place is that visitors would rate that experience as very good or excellent. We're going to set a baseline in 2017 through intercept surveys, and then we will continue to increase that score each year. This is a property tax funded program. It is the Expiration Place is Kansas' premier science center. They provide lots of hands-on activities and exhibits for people of all ages. They are committed to renovating or implementing a permanent gallery each year. This year, it's the Design, Build, Fly exhibit, which that extends over a few years. That'll open up at the end of this year, and that is a very significant program, and I think everybody in the community is excited about that to open up. This is a regional and a statewide resource. There's people from all across the state that come to Exploration Place, and there were 242,000 guests that came or were served through some type of educational programming in 2016. They focus heavily on STEM education, science, technology, engineering, and mathematics. They make those services available to traditional school students. They work with homeschool students. They work with private and parochial schools, and they help those students learn about science and technology. And since Exploration has opened, they've served over 500,000 students in that way. The budget request for 2018 is $2,220,140, the same amount as 2017, and there it is by category. And are there any questions about Exploration Place? Okay, I'm going to move on to the zoo. Page 465. The zoo's mission is to inspire discovery, appreciation, and respect for animals and nature. And it also serves the region, and it is also a resource for adults, children, schools, lots of different field trips. The last month, you couldn't drive by the zoo without seeing a school bus out there. Lots of field trips at the end of the school year for the zoo as well. It is the #1 tourist attraction in the state of Kansas, and it has an economic impact of about $43 million a year based on those visitors that come through the gates. And it is an example of a really effective public-private partnership, and I think we saw some of that last night out there at their annual meeting as well. There were over 710,000 people who visited the zoo last year, and of those, almost 80,000 were students and adults that were either engaged through a field trip or some kind of community outreach activity that the zoo may have undertaken. And their strategic result in the strategic plan is that by 2019, zoo attendance will equal or exceed 85% of the Wichita MSA population. Their funding request is a little bit different than I talked about flat budgets, but this is one difference. There's a request for additional funding in the contractuals line item for almost $400,000. That was part of the funding agreement that we just reached about a month and a half ago. That $400,000 is the funding that would support their half of their capital improvement plan for 2018. The rest of the funding is for staff. We fund 109.5 FTE of the zoo staff, and now under the new agreement, we share the costs 50% of the capital improvement plan. And so that number the total number for 2018 is $6,337,255. Any questions about the zoo?
I see none at this time.
Okay, I'm going to keep rolling. We're going to talk about Lake Afton Park next. That's on page 450. Lake Afton Park is 258-acre lake on a 720-acre piece of property, and it welcomes about 55,000 people during peak season. Peak season is going to start up this weekend, Memorial Weekend. Between Memorial Weekend and Labor Day weekend, there's about 55,000 people that come through Lake Afton Park and take advantage of all the amenities that are available there. The strategic result that we've identified for our strategic plan for Lake Afton Park is that by 2019, the annual cost for Lake Afton Park will be at or below 50 cents per person per visitor. Lake Afton Park has all of the amenities that you would hope for in an outdoor recreation area. There's playgrounds, swimming, fishing, boating. There is a bait store at Lake Afton Park, and we also partner with Kansas Department of Wildlife and Parks to stock fish at both Lake Afton Park and at Sedgwick County Park, and so that also increases the enjoyment for folks that go out there to fish. The request for 2018 is $654,832, and that is spread across those different superior commitment items. And if there are no questions about Lake Afton Park,
Commissioner Renzo has a question.
Yeah, question. I'm looking here at the charge for services. You know, it was around 90,000, 2016, down to 46. This year, 95. What is that?
I think part of that has to do with the blue-green algae. When we had blue-green algae in 16, it drove a lot of the guests down.
That's revenue. That's how much we're bringing. You mean this year?
No, that would be last summer when they shut down the park for about 4 weeks.
Well, this is in the revenue section.
Right. We believe that we're budgeting in anticipation of no blue-green algae. So we think that revenues will go up in 18. Maybe I need some help from Carly. You see that? Well, let us get back to you on that.
Okay.
The blue-green algae did have an impact in 16. I'm not sure why we budgeted less for.
Yeah, that's what I'm wondering.
Yeah. We'll get to you on that.
And how's the bait shop doing as far as making money?
I'm going to let Mark speak to that if you want to come up.
Sure.
But
I have in the past asked for some numbers. I haven't recently, so just off the top of your head, I don't know anything exact.
Well, last year we were getting ready to set some huge record numbers until the blue-green algae showed up, and we suffered through 9 weeks of misery with that.
Right.
And so far this year, we're back on track to top 2015 numbers, so we're doing pretty well.
Okay. Well, is that what the do with what you're saying? Oh, yeah, follow up on this other number here then, because it seems like it should be shifted back a year or something in order to make sense.
yeah,
Okay. Thanks.
we'll get you something on that.
I don't see any other questions, Jim.
Okay. On page 456, we've got Sedgwick County Park, and this includes both the park on the west side of the county and the northeast Sedgwick County Park. The park at the corner of 13th and Ridge, 21st and Ridge, is a 400-acre park with 4 different small lakes. Northeast Sedgwick County Park is 646 acres that is set up with riding trails. And the park served about 1 million visitors in 2016, and we hosted more than 35 different community events. It's a heavily used park, lots of activity every weekend. And the strategic result that we're looking for with the parks is that the annual cost per visitor at Sedgwick County Park be at or below 25 cents per person by 2019. Park offers all of the amenities that you would hope for. We've got shelters that are rented every weekend and lots of days throughout the week. And the park hosts a lot of different activities, runs, walks, fundraiser events. People rent either all or part of that park. We also have identified through this budget process the special parks and recreation funds, so that's special liquor tax funds that go to the park, and those park funds are used to do lots of different things in the different parks. We use those funds to build the plum shelter. There's an assessment of the dam that needs to happen every 3 years, add other amenities, and we talked yesterday in the CIP, when we talked about the CIP, we'd like to spend some of those on an additional restroom for Sedgwick County Park in 2018. The increase that you see in Special Parks and Rec is some additional budget authority that we've added in anticipation of doing that park project, the restroom in the park. Other than that, we're pretty flat. Questions about the parks?
See no, Tim.
Okay. There's your parks. The park summary, it's just over $1 million for the Lake Afton Park and Sedgwick County Park. And here is the summary of Culture and Rec. $9.9 million is the request. And the bulk of the increase is going to be that close to $400,000 that we're doing with the zoo. Any questions about the Culture and Rec part of the...
Commissioner Dennis.
Thank you. Before we get off of this whole program, I've been trying to dig through the book to find out how that this was broken out for community programs. We fund Sedgwick County Fair, African American Museum, Historical Museum, and Riverfest, but I can't see how that those are broken out in here. Is there something I'm missing?
They're not individually identified in the budget.
How do we find out? How can you
I'll
send me
send-
the information on how?
Oh,
those are
absolutely.
broken out?
Yeah. The what we've got budgeted for 2018 is the same as 2017 with the exception of the Riverfest, and so I'll be glad to send that to all of you.
Okay, well, I'm just curious. Some of them have large number of people come. Some of them have small. I just don't know what we're getting for each dollar.
I could get probably within $5,000 on each of them, but I'll go ahead and send you the
problem.
real numbers instead.
Thanks.
With that, unless there's any questions for Jan or John, they may want to step out because I've got like 100 slides on human services.
Okay. Well, thank you all for coming. Hi, Jan. Good timing, Lonnie.
Okay. Now you've got a big packet of slides, and I'm not going to touch every slide. Again, I think the important message is that we've got a flat budget request. There are some decision packages that I'll talk about as we go through. There's ComCare's got one, Aging's got some, Health's got one. So I'll highlight those, but I'll be happy to answer any questions about any of the stuff that we've got as we go through here. The mission for the human services side is to promote health and wellness, independence, and improve functioning for individuals served. I'm going to talk about human services community programs. I'll talk about ComCare. Within that, there's a crime prevention component that we'll talk about. We'll talk about the CDDO, the Division on Aging, and the housing component. Housing used to be a freestanding department, and so it is in your budget books in the economic development section of the budget book, but it's now being managed out of the Aging department. And then we'll talk about Division of Health. ComCare, we'll start with the human services community programs that ComCare now manages, and that starts on page 332. And we're going to talk about the Nonprofit Chamber of Service and the Child Advocacy Center. And Nonprofit Chamber of Service is an organization that probably more than 10 years ago we recognized that if we wanted to have good, strong partners to help us deliver services within the community, we needed to make sure that there were some resources available to those nonprofits. And so the Nonprofit Chamber of Services has been supported by the county for a number of years, and it provides training and networking and opportunities to make sure that those nonprofits that we partner with are successful. Child Advocacy Center is an organization that I think all of you are familiar with. It's a multidisciplinary response to child abuse, and it gives children that are victims an opportunity to tell their story once and to be served in an appropriate setting. They've got a new facility that they've just opened up within the past year. In 2016, they served just over 1,900 children and then 700 caregivers that work with those children. And we are one of many partners, 3 primary partners, the county, the city, and United Way and the state are all funding partners with Child Advocacy Center. The budget request for those 2 programs is $220,440, and the reduction that you see is staffing that have been dispersed. When we went through the reorganization, there was a director's office for human services that was dissolved as I moved into the county manager's office. The staff were put in, one staff went to ComCare, one staff went to health. And so that's why you see that reduction in this funding. And that's that going from $143,000 in personnel to 0. Questions about that? Does that make sense?
Mr. Renzo.
Yeah, on the nonprofit chamber and CAC, are those levels the same as last year, or how has that changed?
They will be the same. 205 for CAC, and it's going to be 10,000 for nonprofit chamber. There was an extra $5,400 that was kind of left over from the transition when we dissolved the division office, but we're not going to spend $15,000 with nonprofit chamber. It would be 10.
Are we doing 10 this year?
Yeah.
What did we do 10 last year, or?
We have done 10 for the past 2 years, and we did 15 3 years ago. It started out at 35 or 40 about 10 years ago, and we have worked it down to 10 the last couple of years.
Okay, thanks.
Mm-hmm. So on to ComCare, begins at page 337. Their mission is to help people with mental health and substance use needs to improve the quality of their lives. I'm going to talk about 7 programs, administration and operations, and within that will be the Shelter Plus Care and Housing First functions that were part of that division director's office in prior years. We've moved that into ComCare's admin and operations function. We'll talk about addiction treatment services, Center City, crisis, community support services, children's services, and outpatient. The strategic results that we've identified for ComCare, we want to increase the number of children that are served by 25%. We'd like to increase the number of people in the community that have been trained on mental health services. There's a training called Mental Health First Aid, which is akin to the Red Cross First Aid, except it focuses on behavioral health issues, and our staff deliver that service in the community so that there are people, just like with the Red Cross First Aid services, there are people, lay people throughout the community that can help identify mental health issues and make referrals to the right setting. We'd like to increase the number of people that we serve there. And then we'd also like to see an increase in the partnership with law enforcement. I think one of the recurring themes that we've heard through budget hearings so far this year is that crossing the line between public safety issues and behavioral health issues continues to blur. And so we want to continue to partner with public safety, law enforcement, make sure that behavioral health services are delivered in the field when it's appropriate. In terms of administration and operations, ComCare has an administration unit that provides all of the standard admin stuff, HR, facilities, finance. They collected $18.5 million for ComCare services. The bulk of that was through Medicaid. We have a EMS billing unit embedded within the larger billing unit that ComCare has that coded 40,000 EMS runs in 2016. We managed about 180 contracts and processed almost 9,000 med records requests from patients. Also within admin and operations are 2 different homelessness programs. Shelter Plus Care is a non-property tax funded program. It is a targeted 112 voucher program serving individuals with a disability that is either related to mental illness, substance use, or HIV/AIDS. We partner with referring organizations and manage those vouchers to get people into housing and make sure that they receive services that support whatever barrier it is that led them to homelessness, and hopefully the services will help them maintain housing. Served 179 individuals in 2016, and then that's a makeup of 121 different households. The Housing First program is a property tax funded program. That is the partnership that we have with the City of Wichita. We split the costs on 64 different housing units that are scattered throughout the community. We served 86 different individuals. The Housing First program is designed to take people from homelessness directly into housing and then connect them to case management so that they can deal with whatever issues led them to that homelessness in the beginning. The theory is if they don't have to worry about housing, they're able to focus on whatever other issues they may have, whether they be mental illness, addictions, any number of things. And so that's a partnership that we manage with the City of Wichita. The addiction treatment program is over on North Waco. They served 1,300 adults at that location. They also manage the 2 specialty drug courts in the community, the municipal drug court and the district drug court. And that 1,300 number includes folks that are served there as well. I'm going to talk briefly about all of these different programs. If you want me to stop on anything, please let me know. The Center City program is our program that is designed to work with homeless, mentally ill individuals. It's co-located with United Methodist Open Door, so we have our services embedded with other homeless services, and we provided both outreach and treatment. We had open treatment plans for 321 clients, and we outreached an additional 318 folks. It can take sometimes a couple of years of outreach before people are ready to accept services, particularly in that population. It's a difficult population to deal with and to serve, but we've got some great outreach staff who will keep going back and keep working with folks to get them into the services that they need. The crisis program may be the most well-known program within all of ComCare services. Those services are available 24 hours a day, 7 days a week, and you can see the services that were delivered. Just over 69,000 calls were taken, 8,000 face-to-face. We have folks that are brought in by law enforcement. We've got folks that are brought in by school staff, families, caregivers, individuals walk in every day. We've got somebody that's coming in for services at the crisis program. And embedded in that crisis service, the crisis program is the Community Crisis Center, 635 North Main. You can see some of the statistics there. Over 3,200 people were served at that location in 2016. And part of those services are delivered in partnership with the Substance Abuse Center of Kansas. SAC does all of the detox work in that facility on our behalf. The Sedgwick County Offender Assessment Program, or SCOPE, is a program that is geared towards individuals that are engaged in the court system, and we work with individuals that are experiencing mental illness and involved in the court system, and we try and make sure that they make appointments, that their mental illness does not become a barrier to drive them deeper into the court system. And we served almost 400 folks in that program. Our Community Support Services program is one of our largest programs. It serves folks that are experiencing a severe and persistent mental illness, and they struggle the most with symptoms related to that. We deliver case management services, therapy services, and med management services to over 2,100 individuals in 2016, and we deliver services with staff. We also contract with 2 or 3 other partners in the community to help split that workload up. Our children's program is very similar to that CSS program in that it serves children who are identified as seriously emotionally disturbed. And so that's kids that are struggling the most with behavioral health issues. And we, again, serve them with case management, therapy, and med management. And in 2016, we served just over 2,600 kids. We also, at our children's program at William and Broadway, we have the Proud of Me therapeutic preschool. We served 56 kids that had been probably kicked out of multiple daycare settings, and helped them and their families figure out how to manage symptoms and get them ready for school so that they can be successful in school. There's lots of really cool success stories with those kids. Again, we serve with staff and in partnership with other organizations in the community. Outpatient services is one of our largest. Again, when you consider the medical, it's one of our largest programs. It serves people 18 and older experiencing a variety of different mental health concerns. And we work with them, again, through therapy and med management to try and help them improve their daily functioning. And there are many people that are able to work in that particular situation. Now, I mentioned med services. We've got medical services at all of our different locations. And we've got about eight FTE physicians and about 12 or 13 nurse practitioners serving 8,700 folks in the community. And we also have one FTE of third-year residents, and so we're a training program as well for KU Med School psychiatry students as well. The budget request for ComCare for 2018 is $5,076,965, and those are the programs where the property tax funds go. And the non-tax funds total $36,377,988. On the non-tax funds, there's a reduction of 7 FTE this year. In part, we need to realign the number of positions that we have with the resources that are available in the community. State funding has reduced over time. It's been flat for the last couple of years, but we had added positions in the early and mid-2000s in response to some additional funding that was available. We've held them vacant. We realized that the funding is not going to come back, and so we've eliminated some positions so that we've got positions aligned with available funding. So the total all funds request for 2018 is $41 million, just down slightly, about $600,000. And again, that reduction is going to be on the grant side. There are 2 decision packages for ComCare. They're similar in nature. The only difference is the funding source. Master's level therapists can be paid for services that they deliver. If they then gain their clinical specialist license, they can be paid by Medicare and by other private insurance organizations as well. So if we have staff that are trained and licensed at a higher level, we can generate more revenue with them. We have about 45, we'll see how many we have, these therapists. And what we would like to do is what we've seen some other programs do. We'd like to have all of those positions classified at the higher level. And then if people don't come into the organization with that clinical license, we'll pay them at the lower level. They're a master's level therapist, but they're not a clinical specialist. So a 128 is a clinical specialist, and a 126 is the master's level folks. So what we're requesting is to reclassify all these at the 128, and then we would underfill the positions at the 126 for anybody that does not meet that clinical license. So there's a 1-year cost associated with the general fund positions of $7,600. But we would not spend that money unless all of those employees were licensed at that higher level. And we've never had a time since I've been here that all of our therapists were licensed at that higher level. This would give us the budget authority to pay people at that level. We know that there's not going to be a $7,600 impact in 1 year. And there's about a $30,000 per employee revenue opportunity for those folks. The second decision package is the same thing, but for the revenue funded, the grant funded positions. And so that cost, if everyone that was a therapist was licensed at the clinical level, would be $132,000, but they won't all be licensed at that level. We do work with, we have seen an uptick in our staff that want to be licensed at clinical level, and we provide you see some of those supervision agreements come through. So there is an interest in our staff in getting licensed at that higher level, and from an organizational perspective, it helps generate additional revenue. And so the total is $139,000, but again, that would be one of those worst case scenarios, best case scenarios, if every employee that was a therapist was licensed at that clinical level. Does any of that make any sense?
But Commissioner Ranswell, do you have a question? Or did I tell?
Yeah, I do not about.
Okay.
It just in general. And do you dispense any medications in any of these programs? You do.
Mm-hmm.
So I'd like to get a list of those and their cost, unit cost.
Okay. Most of what we dispense, we have an in-house pharmacy that's an external third party that has an in-house pharmacy that's embedded in one of the ComCare program areas. And so our staff write the script for the medication, and they take it to the pharmacy and get that script filled. We'll dispense some samples that we receive from pharmaceutical reps.
Right.
And we voucher some medicine. So we'll get you a list of the stuff that we voucher and that we sample. Would that?
Yeah, I want to know what we're paying for the medication.
Okay.
I'd have the same question for the health department.
Okay. Yeah, we will get you that.
For anyone, I've asked it for EMS and the jail and everything, just to kind of get something I want to investigate.
Sure, we will get that for you.
Excuse me, you asked for unit costs.
Right.
The unit cost will vary depending on what pharmacy was used, but we do keep a close track of those medications that we purchase with vouchers, and we keep a running total of that. So you want the particular medications and what we paid out of our budget.
Yeah.
Yeah, what they cost. Like I thought you said you had a pharmacy there that dispenses them, right?
Yes.
Well, so you ought to know. So some of them you dispense directly, some of them you do a voucher.
The vast majority are dispensed by the pharmacy. There's a third party
That's the
pharmacy
main one.
that's embedded.
That's embedded. That's the primary one. I mean, that ought to be pretty.
We don't spend any money on those. That's the patient that pays for that, either with their insurance or out of pocket. The pharmacy is doing business with the patient, but we do dispense some medications, the vouchers and the samples. So we'll get you those costs.
Yeah. Okay. Yeah. All of those. I want to try. Yeah. Okay.
Okay. Any other questions about ComCare?
I don't see any right now, Tim.
Okay. Also embedded in ComCare is the crime prevention program. It's on page 278. This is a long-standing program. The intent is to try and deliver some services to justice system-involved kids to keep them from getting deeper into the system. We contract with 9 different crime prevention programs, served 1,500 youth in 2016. In 2018, we're planning on 7 different programs, and you can see those programs there and the funding that we would propose for them. And that is a flat request from 2017 to 2018. questions on that? Okay. We're going to move to page 368, which is the CDDO. Their mission is to assist people with developmental disabilities to receive quality services and achieve greater independence. They have 2 strategic results for our strategic plan. They would like to make sure that by 2019, 80% of the folks that are being served have an individualized plan that allows them to live their life according to their preferences. And by 2022, we'd like to see that 20% of the folks that are currently living in an institutional setting can be moved into a less restrictive community-based setting. The CDDO has a number of different program areas: operations and subsidized living, service access and outreach, quality assurance, state aid, administration finance, and then capacity development. And there will be, I'll describe what we've done with capacity development, and there's a decision package on capacity development. The operations and subsidized living funding is the property tax funds for the CDDO, and those funds are spent to help individuals access services immediately. There's 4 different organizations that we partner with and contract with for those services, and these funds and this program help keep the CDDO from being a service provider, because they've made arrangements with these 4 organizations to take those emergency placements. Sedgwick County and the CDDO don't have to function as a service provider in addition to being the CDDO. Service access and outreach is a non-property tax funded program. It is the front door for the CDDO and IDD services, and there are 2,592 people eligible for services in Sedgwick County as of the end of 2016. Service access and outreach manages that wait list and delivers services and makes arrangements for services through there. The quality assurance program is responsible for on-site and desk reviews of all of the service providers in the community. The CDDO contracts with 50 different service providers, and QA is responsible for making sure that the services that are being provided meet state standards and that they're in compliance with both the contract with the CDDO and with state regulations. And they served 2,200 folks in 2016 through those services. State aid is another state-funded program, and it is funding that is available for individuals that are on the waiting list or they're being underserved in their current setting. And so it's some targeted funding and it's some targeted services. So it pays for transportation, it pays for some services for kids that the waiver doesn't pay for, and it pays for some non-Medicaid eligible case management. There are individuals that haven't met those, that haven't become eligible for Medicaid yet, but they need some case management services to help them get through that process. And so this funding is available to work with them, and these funds are managed by CDDO staff. The administration and finance program makes sure that all of the things that the CDDO needs to do are done and that they're in compliance with the DDRA. And again, one of the biggest functions of the CDDO is to manage that waiting list and the 2,500 folks that are on that list. For the past 3 years, the CDDO has used some reserve funding that they have, state funding that they have in reserve to do some community capacity building. So they offered to partner with community-based organizations with a 60-40 funding split to help them increase capacity for the system. And most recently, Catholic Charities and CPRF partnered with the CDDO on a couple of different programs. Starkey built an additional facility in a prior year. The 3 years that were approved by you to do this pilot project come to an end in 2017, and we've got a decision package related to one more year, but I'll get into that in just a second. The property tax request fund for the CDDO is $1.9 million, and the non-property tax fund request is $3.3 million. And so the total request is $5.2 million. It is down a little bit, and it's down the $250,000 that we just talked about in community capacity building. And here's the request to do that one more time. The CDDO has funds available in their non-property tax funds to do some additional programming and partner with service organizations in the community. Rather than focus on facilities as we have the past 3 years, this would focus on staff development, and it would be funding that the CDDO and the service providers would partner on. And so the request is budget authority to spend $250,000 in 2018 for those programs. CDDO questions?
I think maybe if you could email me some more details on those programs that you're talking about.
Absolutely. Yeah. Aging services are start on page 394. Their mission is to assist seniors, caregivers, and persons with disabilities and individuals with low income to achieve improved greater health and greater independence. Programs include administration, community-based services, in-home services, PD, physical disability services, transportation, and housing. And housing, again, is in your budget book in the economic development section. Used to be a freestanding county department. It was embedded into the aging department in 2015. Some of the services that aging delivers are focused on helping individuals remain in the community and in their homes. The goal always is to keep people out of the nursing home. That is the reason for the Department on Aging. And the strategic results that they've identified is that by 2019, 85% of Sedgwick County seniors will be able to stay in their homes. Medicare beneficiaries will realize $225,000 in savings through the SHIC program, and that 35,000 individuals will receive information and referral through their services of the ADRC. Aging administration does all of the things to help administer the program. Their goal is to make sure that they are good stewards of all of the different tax funds that they deal with. Aging services are funded with a blend of federal, state, and local taxes, and it's a sometimes very complex mix of funding. The community-based services that they deliver are some of them are delivered by staff. They do a lot of partnering, purchase of service with folks in the community, and they served 9,800 folks through local funding. We also funded 17 senior centers who helped over 10,000 people, and then over 14,000 folks were served with state funding through community-based services. And again, those are services designed primarily to keep people out of the nursing home. In-home services, similar, but they're more intensive services. There's a blend of funding between local and non-local funding. Homemaker services, home-delivered meals, case management, minor home repair, some legal services are all the types of services that we do in-home, and they are again delivered by aging staff. Most of them are delivered through purchase of service and community partners. 38,000 folks were served through the in-home services in 2016. the PD program is funding that is available for people who meet that definition, the physical disabilities definition. 677 individuals were served. Almost all of this funding is going to be purchase of service with local community service providers on behalf of individuals who have a physical disability. The transportation program continues to deliver services to seniors in and around the community. Just over 28,000 rides were provided. Most of those rides are provided by aging staff in aging buses. There are some purchase of service depending for some specialty transportation, but most of those rides are provided by aging staff. The property tax fund request for the Division on Aging is $3,066,295. Their non-tax request is $7.1 million for a total request of $10,180,052. The Division on Aging has 3 different decision packages that were developed on behalf of and at the request of the Aging Advisory Board, and so staff worked with the advisory board to complete these 3 different decision packages. Senior centers are there is a funding formula for senior centers. If senior centers request and then are able to demonstrate that they're operating at a higher funding level, they are eligible for funding if funding is available. Funding has not always been available to move senior centers up. The advisory board recommended that we request $73,000, which would cover funding requests for 3 different senior centers to move up a level, because they have made the request and they have demonstrated that they're operating at that higher level. So that's the request for senior center funding. There is a recognition that there's an increased demand for services, and the cost of services that are purchased in the community continue to become more expensive, and so there's a request for $35,050 to be added to the home and community-based services for aging services. The plan, if this decision package was funded, would be to go back to the advisory board and have them identify where they would like to see those dollars spent. These are enhancement dollars to existing service levels. And then there's a similar request for $5,000 for the PD program. So there are 3 different decision packages from the Division on Aging, totaling $113,050.
Commissioners, any questions?
Okay.
The request for the senior centers, that's to be just divided on the basis of their qualifications.
There are 3 of the, I think we're funding 17 senior centers right now. There are 3 senior centers who have demonstrated for 2 years that they are operating at the next level, next funding level. There are funding tiers for senior clubs and senior centers. If they demonstrate that they are operating at those higher levels, delivering more services, delivering a wider variety of services, serving more people, then they can request funding at the next highest level. And so we've got 3 different senior centers that have demonstrated 2 years of service at that higher level, and so this would make those. The $73,000 would allow us to fund those 3 centers at the higher level. All the other centers would remain on the tier that they're on.
And that's because they haven't met their next level.
Correct.
And we're not obligated. That's just they can make a request.
That is correct. From the inception of this funding plan, it was very clear that any changes in tier funding would be based not only on their delivery of service, but availability of funding. And so there have been a number of different years when we've not had additional funding available, and so we have not been able to fund them at the higher level.
Okay. Commissioner Howell.
Thank you, Mr. Chairman. Just a clarification. There's an aging mill levy, dedicated aging mill levy. Is that right?
Yes, there is.
And do you know what that is? Or is that somewhere I can see it?
I know that Lorian knows what it is.
Commissioners, Kami Carlston, budget analyst. If you look on page 395, under budget summary by fund, at the bottom of the page, there's a line that says aging services, and that is Fund 205 for aging, their property tax fund.
Okay, so as the growth in the community happens, it does generate a little bit more dollars each year, hopefully, if things continue to improve here in the economy. And those dollars are split among a number of different programs. Part of that is some of the things that are in their decision packages. If we were to agree with those decision package requests, does that somehow pull money out of other programs that otherwise would be getting that money that you need elsewhere?
If I understand your question, the answer is going to be yes. The aging services are funded with three different types of funding. Some of it is that aging mill levy, then there is general fund funding, and then there is the revenue funding that comes from the state and those folks. So the revenue that's generated by the aging mill levy does not cover all of the local tax funding programming that we do, and so it is augmented by general fund funding.
Let me ask a question another way. Whatever that aging mill levy is set at currently, and again, I'm not sure that I see that number anywhere, but I believe under the either the county resolution or a state law, I'm not sure which, there's an allowance, if you will, to create the structure, if you will, for this mill levy. Is that like a 1 mil or 1.5 mils or something like that? That there's an allowed, if you will, dedicated mill levy for these types of services?
I believe that the cap is 1, and I think right now we're at about a half.
Yes, Commissioner, for 2017, the aging mill levy is 0.523 mils.
What was it again?
0.523.
And when's the last time that was changed? Do we know?
Well, in 2016, it was 0.56. So it varies from year to year.
That was in 2016?
Yes.
Okay. So if we approve these decision packages, will that just calculate that to a slightly different mill levy? Is that what you're saying? So we're not looking at the dollars first and then figure out where to put the money. We're looking at what money is needed and then calculate the mill levy that corresponds with that. Okay.
Yes.
All right. That's all my questions for right now. Thank you, Mr. Chairman.
Thank you.
Okay. Housing is on page 481, and it is a mix of property tax and non-property tax funds, and it is the program is designed to assist individuals with low and very low income to achieve safe and affordable housing. This is the Section 8 Housing Choice Voucher Program, and aging staff administer this program, and the funding request for 2018 is $35,280, and then the value of those vouchers is just over $1 million. And so we served 188 families in 2016. And I'm sorry. So the total request for housing for 2018 is $1,087,428. There's a slight reduction. The number of vouchers goes down, I believe, by 1 or 2. If there's no questions about housing, I'm going to go ahead and start on health. And health starts on page 417. And Commissioner Ranzau will get you information about the prescriptions that we fill. The mission of the Health Division is to improve the health of Sedgwick County residents by preventing disease, promoting wellness, and protecting the public from health threats. Again, some programs that we'll talk about are administration, preventative health, children and family health, health protection, public health performance. And there's a lot of slides related to the health department. Bottom line is that this is a flat budget request, slight reduction tied primarily to some shifting of programming from health to emergency communications and aligning some budget authority with reducing grant funds. The strategic results that we've identified for the Division of Health include that by 2019, 85% of reportable diseases will be investigated consistent with KDHE guidelines and regulations, and that by 2019, no more than 7.8% of the babies born in Sedgwick County are with low birth weight. The administration section of the health division does all of the things that you would expect them to do related to operations, HR, process. They seek 100% compliance with their funding. Again, we've got federal, state, and local funding supporting Division of Health activities. Embedded in the administration budget is Project Access. That is, again, requested at $175,000. That's the same request as we've had for the last few years. Project Access seeks to leverage, the Central Plains Regional Health Care Foundation seeks to leverage donated physician time and medical care, along with some prescriptions and durable medical equipment for low and uninsured Sedgwick County residents. They helped 1,149 patients in 2016. Preventative health program includes both property and non-property tax funds, and there are a number of different activities embedded in that particular program. One of them is the central supply. They manage over 2,300 vaccinations. They managed over 2,300 vaccinations in 2016, and they provide that service for the entire health department. Our customer service component is made up of the call center and medical records at the clinic, and they served over 14,000 residents in 2016. The health department on West Central is a high volume medical clinic, and there's a lot of folks through there every day. Also included in the preventative health budget is the immunization program that provided almost 22,000 immunizations to almost 9,000 clients. 14,880 of those were children under the age of 18. We've got a mobile immunization clinic that tries to target those kids between the ages of 2 and 3, make sure that they're current with their vaccinations. 1,800 residents were helped in 2016 with that program. There's a family planning component to the general clinic. They served 2,900 clients. Their goal is to help women space their pregnancies, have them be planned so that we impact low birth weight through that program. Maternal and child health, again, counsels clients under the age of 22 in terms of family planning and STDs and STIs. And the goal there is that they helped over 800 residents in 2016 through that program. The STI testing program is different than the STI investigation program, which is a few slides later on. The testing program, the goal of the testing program is to make sure that they test 96% of the people identified within 14 days in an effort to stem the spread of those particular diseases. And almost 16,000 tests were performed in 2016 on behalf of 2,200 different residents. There is a lab that supports all of the services that go on in the clinic, including the STI investigation unit. and they performed 24,000 tests in 2016. Children and Family Health is made up of a couple of different programs. The largest one is going to be the WIC program. It served 22,257 women, infant, and children in 2016, 105,000 times. Those folks are coming back every month that they're eligible for services. Healthy Babies is another big component of the Children and Family Health program. That is a program designed to try to avoid poor birth outcomes for at-risk folks, and they served just over 1,500 folks through 7,200 visits in 2016. The Children's Dental Program is a program designed to serve kids between the ages of 5 and 16 that aren't covered by insurance or Medicaid. It does a lot of dental screening in schools. They screened 15,000 children in 51 different schools in Sedgwick County last year. They utilized 23 different volunteer dentists to deliver services, and the value of those services exceeds $70,000. Those are all we provide the support staff, the hygienists and technicians, and the volunteer dentists come in and do work for kids who don't have coverage for dental services. And they served 334 children with 1,045 different services in 2016. The Health Protection Program involves tracking, monitoring, and trying to prevent the spread of disease, working with the state of Kansas. They work very closely with KDHE on all disease reporting. They monitor, they're in contact with hospitals and clinics and healthcare providers in the community on a daily basis. They performed almost 1,300 disease investigations in 2016. The TB program served 251 different clients, 10 of them with active TB, and they do testing, they do directly observed therapy. They make sure that they do everything they can to suppress the spread of tuberculosis. I think some of you recently have been by to visit, and that one of the things that we've done that's really made a difference in terms of efficiency is that we do a lot of that direct observed therapy, which means that we have a nurse observe the patient, take their TB medication. We're doing that through televideo, and so we've saved thousands of miles on county cars by using technology to do that rather than go to the home or make the patient come in. The STI control program performed 1,273 investigations. So these are the investigations that lead back to that treatment program that happens at the clinic. And animal control is part of health protection as well. They made over 2,000 field calls tied to 34, including 34 different bite investigations, and they're out in the community every day as well. Public health performance involves the public health planning activity, and one of those activities involves the community health advocate program. We've got an employee who trains community volunteers who take the message about the importance of a medical home into the community, into natural settings. And so we train volunteers who go back to their churches or their neighborhood organizations and talk to individuals about the importance of having a medical home, making sure that they get connected to one of the, if they don't have a primary medical home, they get connected to one of the community safety net clinics in an effort to make sure that the overall health of the community improves. And so they delivered information, those volunteers delivered information to over 3,800 folks last year. The Fetal Infant Mortality Review Program is embedded in the health planning program as well. They looked at 24 different cases in 2016, and they identified 3 different cases where there was a specific recommendation based on what they found in that review. The health department is very committed to quality improvement. They've got performance measures for all of the activities that they perform, and they've got quality improvement principles and practices that they implement. And in 2018, they made sure, or 2016, they made sure that 98% of their staff were trained on quality improvement techniques, and they completed 11 different QI projects in 2016. They also are concerned with workforce development and making sure that there's an adequate healthcare workforce in our community. They worked with 322 different students. They may be undergraduate students, graduate students. They may be medical students at the School of Med across the street, making sure that they have a clear understanding of the value and the benefits of public health and trying to encourage them to be involved in public health service. And there is a community health assessment, and Sedgwick County participates in the collection analysis of the data that helps form actions and activities on behalf of the entire health system in the community. The property tax fund budget request for 2018 is $4.8 million. Non-property tax is just over $7 million. Total request is $11.9 million. That's down just a little bit. And again, part of that is going to be a reduction in budget authority tied to grants that have diminished over time. And some of it is tied to transfer of some staff and activities and funding to emergency management that was embedded in the health department in the past. We've got one decision package for the Division of Health, and that is tied to additional budget authority tied to the cost of vaccines. Commissioner Ranzau, as you indicated, medications are expensive. We spend a lot of money on medications. We've seen an increase in costs for adult vaccinations, and so additional budget authority is needed to make it possible to deliver those services, collect those fees to make that work. So the summary for the human services component of the Department of Public Services is a budget request, all funds, $70,272,703. It's down close to 2.5%. There are $590,960 worth of decision packages, but $250,000 of that is that CDDO request that is non-property tax fund. It's a non-property tax refund request, and that's the same with $131,000 of that ComCare request. That's a non-property tax fund request. We got through over 100 slides in an hour and 15 minutes. What kind of questions do you have?
Well, first of all, nice job. That's
Thank you.
A lot of information. The private immunization budget authority, though, that ends up being a revenue generator. I mean, we'll generate excess revenue with that,
Correct. Yeah.
assuming we sell a product.
Right.
Okay. We're clear about that.
We have adjusted our fees over the last 12 months or so. We've taken a very close look at fees that we charge for immunizations, and we recognize that not only are the costs going up, but we weren't keeping up with our charges, and so we've increased our fees, but we need some budget authority to make that happen.
Okay. Commissioner Dennis?
Thank you. I'm sorry, I'm still slow trying to learn what I'm doing.
Me too.
Back on public services, I know that we've gone through a lot of slides since then, but one of the things is that boundless playground, and we've talked about it out at Sedgwick County. Is that in the budget? Because I can't find it.
It is not in the budget. We had that would certainly be an option that's available to all of you if you chose to fund that. The last budget, the last expenditure that we had on the boundless playground was in 2016, we purchased a swing that will be installed, and we paid for some architectural drawings, and that was based on a request from the Sunrise Rotary at that time. They came to you in the fall, late summer of 2016, and made that request, and they announced their fundraising plan. And at that point in time, their request was just for the architectural drawings and the swing. After we had prepared our budget documents for this year, they came forward with that request, and that's one of those that we may want to talk more about if you'd like to. But I didn't get that request in time to include it in the budget process.
Okay, but they did submit a complete package to you.
We do have a request now.
Okay. Well, I hope we don't forget about it. Okay. The other thing is just a general comment. We went through this, and a lot of this is numbers and it's kind of dry. But I was able to tour every one of these facilities and all these different organizations, and all those numbers are people.
Yes, they are.
Until you tour it and see that we're touching thousands and thousands of people here in Sedgwick County, it doesn't. I don't think these slides do it justice of what your department's doing. So I just want to congratulate them.
Well, thank you for pointing that out. You're absolutely right. All the numbers that are in there are tied to people, and not only the people that are served, but a lot of really dedicated staff that deliver services.
Thanks, Commissioner. Commissioner Howell?
Thank you, Mr. Chairman. On the decision package, the rationale says choosing to end the vaccination program would force over 2,000 residents. No one is suggesting we would end a vaccination program this year, is there? I mean, this request is $88,000. Is that the increased cost of immunization? Is that what you're saying?
That's additional budget authority.
But this
Correct.
is because things cost more. So it's continuing what we've done in the past.
Correct.
So to do what we've done in the past requires this much more money because the drugs we're administering cost more this year.
Correct. And it's a fee-based service, and so there would be revenue tied to those additional costs.
Right. Okay. Back on that idea on slide 67, I guess it is. 21,717 immunizations in 2016. Can you talk about what that number was in 2015? Do we know? Total. I know we changed the way we administer immunizations. We went from 3 programs to 1, but any idea what our total was in 15?
Our number of vaccinations given did decrease a little bit, but the number of high volume vaccines increased. So we did serve slightly less people, but the people that came in requested more of the vaccines that cost more.
Can we get some numbers I'd like to just see some numbers on that if you don't mind. I know I've asked for that in the past, but give me an update if you don't mind. I'd appreciate that. And you're not talking about the traveling immunizations either. That's not part of this discussion. Okay. Just along that line, I guess I didn't realize. I think maybe I did know this, but I'm not sure. I think I forgot about it. But we have a mobile immunization program that goes to schools and businesses and senior centers.
Yes, we do.
That's good. I think I forgot that detail, but that's fantastic. I have a couple of other comments and questions here. On the children's dental program, say there are some who are not eligible for Medicaid or Health Wave who qualify for free and reduced school lunch programs. These are kids that don't have any other dental.
They're kids without resources. Correct. They're kids that don't have any resources, and usually they're identified through those school screenings, and so the staff that do the screenings then work with the school nurses to see what kind of resources they may have, and if they don't have any resources, then the nurse will refer them back to have the services provided by those volunteer dentists.
I happen to notice that there's 3.12 services per average child. If you just divide that out, there's 1,045 services for 334 children. Are these services things like cleanings, or are they filling cavities, or what kind of things are we talking about?
Both. Oftentimes, there's going to be cavities that are identified through that screening, and so when they get the kid in the chair, they're going to try and do a cleaning and take care of that cavity or cavities that they've identified through
So
the
if they're in the
screening.
chair one time, they do a cleaning and a fill a cavity. That's considered 2 services or something, right?
Yes.
Counting multiple?
Correct.
Okay. You know where I'm going to go with this, and I'll just bring it up now, and that is, I've spent a lot of time in nursing homes lately. I'll just bring it up. And I have a story where I've discovered that apparently people who are on Medicare, Medicaid, maybe even hospice, but let's just talk about Medicare, Medicaid for just a minute. Apparently, there is no dental service for someone in that situation whatsoever. So if someone has an infected tooth or whatever, something that is causing them tremendous pain, there is no solution anywhere in our system for that. And I to the extent we're trying to help out people through this program, I'm wondering where does my concern lie? Is that in the Department of Aging or in the Health Department or Project Access? Somewhere in this system of care, I'd like to know if we identify someone, some agency, some program that can begin to address this issue of seniors in pain that have no other options. What do they do for a solution? I don't know where that would be, but somewhere we need to find a solution for that.
Dental services for people of all ages, but particularly older and uninsured, are one of those things that there's just not much of there are no programs available. Medicaid doesn't cover dental services other than for children, and so it is a challenge for every community. I will let you know that it may predate you, but in the early to mid 2000s, the former Division of Human Services had a pilot. We did a supplemental budget request and did a pilot program for a couple of years where we had $100,000 budgeted for dental services that then we purchased in the community at the Medicaid rate, but it was for people who did not have coverage, and we got referrals from the Department on Aging, from ComCare, and from the CDDO, and we paid for a large number of services, dental services, because we recognized that there was that gap in the service system in not only in our community but in the state and in reality across the country. And so that was a program that we had implemented earlier in the early 2000s. It was well used, lots and lots of referrals. It was one of those things that through the budget reality we had to eliminate.
Okay, so 334 children, and these are kids that came to our health department to get services in our facility. Is that correct?
Correct.
That place is open probably 260 days a year, I'm guessing, and they only have 334 children. So I'm guessing most days there's probably not someone in the chair, or maybe there's days where there's a couple of kids will show up, but a lot of days where there's no one there doing services. Is that correct?
That is absolutely correct.
So there's probably some capacity where that facility could be used for more services if we found a need for it, I'm guessing.
If we found a dental resource to stand next to the chair. The chair availability, the chair's there. The challenge is to get those 23 volunteer dentists, is it 23? Those volunteer dentists to work with. It truly is volunteer on their part. They come in and they deliver the services. We make sure that there's a chair available and that there's an assistant available, but they're delivering that care, that dental care, at no cost.
We provide supplies and other things that they might need there.
Correct.
Okay. I don't know about my colleagues here, but I'm concerned about this population, and I don't know what we can do about it. But whether it be through Project Access or through some type of one of our health, Hunter Health Clinic or whatever, or whether it be done through Health Department or done, I don't know. I would like to say if there's a way we can leverage some support to create, I guess, a parallel program where we might have some volunteer folks. Again, if they could try to find some more dentists that would be willing to recognize this need, or whether or not we can get anybody else to partner with us with some dollars. But To me, this is it's a fairly significant part of our population that has no options whatsoever. And to the extent that we have a lot of stuff in this budget that is trying to help with people who have no other options on all kinds of things, it seems like a pretty big deal. That I'm not suggesting we create dentures and crowns and bridges and replacing missing teeth. I'm talking about taking care of pain. So if someone has teeth that need to be pulled because they're aging and they've got some problems going on there, I'd like to be able to see some type of mercy given to these people through some program somewhere. I don't know where that settles in this entire budget, but I think we need to solve the problem somehow. At least try to solve the problem, get the ball rolling somewhere.
I'll be glad to work with my staff and see if what we can come up with, and see if there are some alternatives that we haven't approached in the past, and maybe talk to Adrienne about talking to her dental contacts and see if there's additional capacity and an interest in serving non-children.
I just wanted to raise that issue. I'm very concerned about that. I didn't know it was such a big deal, but I think it is a big deal. Along that line, let's see here. Let me ask a couple more questions. 34 dog bite investigations in 2016. Did we actually declare any of those dogs to be a dangerous animal?
We did not.
We did not.
No. We investigated, and based on the findings of those cases, none of those dogs met the criteria to be labeled as dangerous.
Do we have a similar definition in our dangerous dogs as the city? I don't really know. I've not looked at this side by side to see how they differ, but I was told they're very similar.
My understanding is they're very similar. We could certainly have legal take a look at those two and see if there are any differences between the two.
Okay. I just want to make sure, if someone out there has a dog that has I understand sometimes dogs will bite because someone's on, they're trespassing on someone's property, or they've got puppies, or all kinds of reasons why a dog might do something like that. But if the dog is aggressive and there's a child that's bit or something like that, I guess I'd like to know that we're doing that correctly. We're not being overly lenient. I guess we're trying to be consistent with what we think ought to be done there. So if there's an issue, we're taking care of it. If there's not an issue, that's fine. I just was surprised 34 dog bites and no dangerous dogs. We heard that at a previous meeting. I was wondering if that was true. And I think I had on the Healthy Babies program. I think in 15 we talked about. I heard some numbers on infant mortality in previous years. I haven't seen any updated numbers. Can we talk about infant mortality? Is there an updated report on what we're doing with infant mortality in Sedgwick County? I'd like to know how that's changed.
The latest numbers on infant mortality, and their 2015 numbers are that they have lowered. But we also know that there were 9 sleep-related deaths
In 16.
Yeah,
that's what I was wanting to see what that looked like.
Yeah. So those numbers are always like a year and a half behind, and so we don't
Really?
from the state, yes, and so we don't have those yet. And then we'll look at those in 3-year increments versus just 1 year by itself, so we can look at trends, because they can spike. Like 2016 is likely there's to be a spike, particularly in the sleep-related deaths. But the latest number is showing a reduction.
Why don't we have our own local data? Why do we have to go to the state, and then it takes so long to get the data back? Why do we do it that way?
Well, because everyone is reporting their data to the state, and so we have our own internal program data from all of our programs, but we don't have access to it. If we want local data, we have to go to the state to get it. So we have our up-to-date, real-time data, but the state houses everybody else's data.
Providers are required to report to the state. They're not necessarily required to report to us, and so that's why we rely on state data.
Do we have demographics as to where those 9 sleep-related deaths happened? They were in Sedgwick County, but we don't know where in Sedgwick County.
That won't be released just because the numbers are so low. They don't want it to be identifiable per zip.
But the Healthy Babies program is identified. It is focused on a couple of zip codes. Is that correct?
Well, the
Primarily.
Healthy Start grant has identified. If they look at the zip codes and the high lives in mortality, and those become the zip codes that they want the Healthy Start funding to be centered on. And those, I think, we used to have 3 zip codes, now we're up to maybe 9. But when we're looking at really low numbers of infant deaths, they're not going to identify per zip because it's too close to home as far as someone maybe being able to identify who that person is, and so the state does not do that. We don't do that. The state doesn't do it. It's considered confidential information.
Okay. Let me think about that for a while. I appreciate the answer. I don't think I have any other questions right now. Thank you, Mr. Chairman.
Thanks. Commissioner Renzo.
I just have a question back on the dental program to clarify. Now, do we have dentists in the office every day, or is it kind of sporadic and they're scheduled, or?
They typically, oftentimes their office is closed on Fridays, and so they come in on Fridays and or the evenings. And so we work around their schedule, and so if they want to come in, if someone wants to come in every day after 5, then our staff are there every day after 5.
Okay, but these aren't necessarily, the kids that we're seeing aren't necessarily that just happen to show up there, or are they? Or aren't they
No.
the result of screenings that we're doing as well, right?
Correct.
And then we say, go there on this date and time, because we know they're not just like walking in on a daily
We
basis.
don't take walk-ins, it's just scheduled.
Okay.
And they're identified through those
Through the screening,
screenings.
that's how they're all getting there.
Right.
But that's what I thought. Okay.
I don't see any. I have one question, and Tim, I've talked to you about this before. It's on the we'll clear back to the prevention funding.
Mhm.
That our decisions on who to fund comes through recommendation from WSU. Is that right?
WSU helps do an evaluation, and then Team Justice. The ComCare program staff work with corrections program staff and Team Justice to evaluate the RFP responses. We do a joint RFP for both the crime prevention funding, and there used to be a lot of JJA money. Now there's just a little bit of JJA money. We do a joint RFP, and then that RFP is evaluated by ComCare and corrections staff, and that is run through Team Justice then.
Okay.
But
Several
WSU
people
does an
are
evaluation. Correct.
I guess I was just looking at some of the numbers here, and the one program's got 25. Is who they expect to serve 25 people, and it's $95,000 cost. So we're spending $4,000 a person, and nobody else was even close to that. So I just wondered about the $5,000.
And there's programming along the continuum of risk. And so some of those programs, that particular program is targeted towards extremely high-risk kids. Some of those programs where they're seeing hundreds of kids, they're either moderate or low risk.
Okay. Any other questions, commissioners? Well, nice job.
Thank
A lot
you.
of stuff. Thank you all for being here and being able to help with answering questions. If there's nothing else from commissioners or from staff, we'll be adjourned. Or Lorian, we're all done, right? I mean,
We're all done. That was our final one.
okay. So if we have a question, just call you.
Absolutely.
We talked about potentially having some discussion after this presentation was over.
I'm sorry.
We talked about potentially having some discussion after this presentation was over. Is that on the agenda?
Commissioners, we do
Well,
have.
we're ready for that if you want to have a discussion.
Well, I just had one question, I guess, and
Okay, we're not done yet, folks, so.
I apologize. I think I'm done with Mr. Kaufman, but I have a question, I guess, for manager and maybe Lorian. So y'all can go if you want. I don't care. I can ask you later if you'd rather. I can talk to you later.
Now's the time for discussion if you have a question.
Okay, so looking at the budget book, and I got a gigantic stack of presentations we've gone through, and I think 17 hours of planned planned hearings, we probably did most of that. There's a lot of information there, and the decision packages. One of my questions is, this budget that was presented, I guess on page 7 of our budget book, is kind of a starting point for our discussion this year. That does not include any of the any decision packages. It does not include any salary increase for our roughly 3,000 staff. Is that correct?
That's correct.
So those decisions, we have a summary of decision packages that I guess I should go back and look. This is summarized, I assume, in the back here.
Starting on page 15, there is a summary of all the decision packages that were submitted. It's also in behind the decision package tab.
Okay. So to be consistent, there's no decision packages in any of the numbers on the first pages of this book. Nothing included there at all. All the decision packages are yet to be considered, and we'll change the numbers with whatever we choose to add and what we choose not to add.
Yes, some of them are included in the forecast, but not in any of the budget pages.
How do I know the difference? I mean, how do I know which ones are included in the forecast, which ones aren't?
I believe Lindsay had sent earlier this week a list that shows what are included and not included, but I can resend that to you.
Okay.
Based off of Council's request.
Okay. Well, that was my only question. Thank you.
Okay.
Sorry I kept you all.
Anything else? Okay. There isn't. Anything else? Tom, did you have a question? Oh, did you have a statement? Okay. Well, then I guess we'll be adjourned.